Good afternoon, folks. Robert Chappell, Executive Editor of Madison365 here with your daily updates for Wednesday, November 10th. It's not good news today again, folks. And the news, unfortunately, is kind of incomplete today. So I'll tell you more about that in a minute. But first of all, I have to tell you that the update today is brought to you by Quartz. And Quartz offers access to high-quality healthcare and innovative wellness programs to help you live your life to the healthiest, to chase your passions and follow your dreams. That's why it's everything they do, from the way they build their plans to every product and service they offer, is designed to get you where you want to be. Their plans and services are created to fit your lifestyle and make sure you have access to healthcare where and when you need it. At Quartz, customers are at the center of everything they do. Visit quartzbenefits.com or call 800-362-3310. Again, 800-362-3310. It is open enrollment period, right? Now's the time. If you're going to change your healthcare, now's the time to do it. And Quartz has always been a good supporter of Madison365, and we appreciate that. So let's talk about some health issues here, some public health issues. Our new confirmed case daily average has jumped again up to 2,453. I believe that's like 200 more than yesterday. That's a sharp increase. The 7-day average yesterday was 2,309 yesterday. Today it's almost 2,500. So about 150 more today than yesterday. That includes 3,370 new cases reported just today. The number that bothers me the most is the positive test rate. It was 9.0 yesterday. Now today is 9.4. 9.4% of all tests in the past 7 days have come back positive. That's the highest that number has been since January 12th. No, I'm sorry, that's wrong. January 11th. It was 9.4. January 12th, it was 8.2. So it was falling in January. Today, it's 9.4 and rising. It got about this level early October last year. Remember the surge last year through September, October? It lasted well into December. So we are right now where we were October 2020. That's less concerning this time around because we have vaccines now that we didn't have then. Right? So ideally, this number will turn and start to go back down. Not only is this high, but it's rising. That's what really bothers me. That, much of October, this number was going down. And now it's just taking this turn and it's going back up, which I don't love. So, unfortunately, that continues to rise, 9.4%. The death average is now 15. It was 14 yesterday. So, in the past 7 days, we've reported 15 deaths per day. 21 new deaths just yesterday. Again, these are deaths that didn't happen this week. These are deaths that are being reported and confirmed. We are now at 8,688 total deaths, plus 953 probable deaths. So probably we're approaching, we'll be honest about it, we're approaching 10,000 deaths if you count the probables. Hospitalizations also up again today. 1,071 currently hospitalized. That's 42 more than yesterday. That's 143 more than a week ago. That's also not great. That was coming down. That peaked at about 1,100, right? And was well below 1,000, and now it's back up over 1,000. So that's not great either. Total ICUs in the state are about 94% capacity. So you got about 6% of those ICU beds across the state are available right now. That's getting kind of tight, so we don't love that either. Dolores asked the question, what's going on? It's hard to say. Honestly, it's hard to say. I could speculate, I could theorize that because we haven't had mask mandates in this state other than in Dane County, really. Dane County continues till November 27th. But I think it's reasonable to suspect that those numbers were coming down and people across the state got a little complacent. Or, this is kind of the way viruses go, right? If we did nothing, these things would go up and down without any intervention, without any complacency. Like day to day, things would go up for a few days and come down for a few days and go up for a few days, and would generally trend upward if we did nothing at all. So this might be just sort of a natural part of the natural up and down, and we just got a little bit overconfident when it was going down, and now it's going back up, right? So, yeah, this is very important that Jean Marie says that hospital staff and resources are needed for non-COVID patients. I was told last fall by Dr. Ashok Ray, the CEO of Prevea Health, that a COVID patient, tell me if this is true, Jean, that a COVID patient, at least at that time in Green Bay, took about 3 times as many resources as a normal patient. Like having one COVID patient was like having 3 non-COVID patients, which really puts a strain on resources, right? So it's important that those of us who can stay out of the hospital, can stop ourselves from getting COVID, do so. That includes wearing your mask, keeping your distance. Thank you, Gene. Not that I didn't believe it, but I would always welcome additional perspectives. But it's important that we do our best to stay out of the hospital, to keep from getting sick, which includes keeping the masks on, staying home when you can, and getting vaccinated. Like, that's really key. And now we can get our kids vaccinated. Speaking of vaccines, unfortunately, yesterday, the news I mentioned some really good news that the vaccines that we're getting 20,000 doses a day, which is much more than it was even a week ago. A week ago, it was like 3,000 a day. And now that kids are getting vaccinated, that's going up. It's kind of surging. The number of vaccines that are getting done is surging, which is great news, I think. Unfortunately, today, that data is gone. And the most recent vaccine data we have is for November 5th, which is a week ago. So it still looks like it's 3,000 a day. And I don't know where the last week of data went, why it's not on the website anymore, but it's not there. But the fact is, I can't tell you today what it is, but as of yesterday, at least, it was like 20,000 doses a day being given. That's great news. Okay, so that's basically the COVID news today. Yeah, Jean is speaking as a healthcare provider working in a hospital. You're getting 15 to 40 new patients every day. Each of those is like having 3 new patients in a day. So you're looking at, the equivalent of 45 to 120 new patients every day, which is bonkers. So, and that's just the most severe cases, right? A lot of cases out there spreading it to other people without going to hospital. So everybody get vaccinated, behave yourself, get your masks on, stay home if you can. This is not over yet. Not over yet. That's the bottom line. All right, that's the COVID news. We're going to take a short pause. We got some other news for you, including some very good news about your favorite news outlet, Madison365. We're going to come back right after this.
Apply yourself. At Madison College, we encourage you to be your truest self. You're a trendsetter. Whether it's the clothes you're wearing, the music you're listening to, or the new game you're playing, you're into it first. Friends and family seek your advice because you're a natural-born leader. For you, life is all about taking things to the next level. And at Madison College, we can't wait to see what you do. Apply yourself today.
All right. Now, I have some good news for you from Madison365. We are members of an organization called Lion Publishers. Lion stands for Local, Independent, Online News Publishers. We have been named finalists for 3 national awards from this organization. This organization represents, I think, about 400 local newsrooms like ours that are online, independent, and do local news. And we are finalists for Best Solutions Coverage, for our series on incarceration after COVID that we did in collaboration with the Wausau Pilot and Herald. We've been named a finalist for Best Investigative Reporting for my work, my covering the case of Jimmy Joshua, who was a resident at the Dane County Jail, had his hip broken, and then spent 15 hours alone in a cell after having his hip broken. Spent 8 days in the hospital. And I am we are finalists for Best General Excellence in Revenue Growth, which is kind of behind the scenes stuff regarding this show and the advertising and the podcasts and all that stuff. So that's very exciting. We will know whether or not we won those awards on November 16th. This is the third year they're doing awards. We actually won Best Breaking News Coverage and Publication of the Year back in 2019, the first year they did it. So fingers are crossed. Keep your fingers crossed for us. Laura asks a good question. Is the COVID news you report on the podcast new in the morning, or is it sharing what came out the evening before? The data comes out, and this has changed over time, right? It used to come out at a certain time, now comes at a different time, whatever. The state data comes out at 2 p.m. So the data that I have for this show is exactly the same data we have tomorrow morning, right? So the idea being these are different audiences, probably, like some people listen to the podcast, some people watch this show, some people do both. What you have in the morning podcast that you don't have now is like tomorrow morning's stories, right? I know it's going to be on the website tomorrow morning, pretty much. But I don't talk about it here. I talk about what we had this morning on here. So that's the difference. That's the difference. The data is the same. The podcast often has more data. Like on Thursdays, or rather on Friday mornings, Thursday nights, Friday mornings, we go over the Dane County data snapshot a little more. But I appreciate, Laura, I appreciate you tuning into both. And Stephanie sometimes gets into, my co-host, my wife and my co-host Stephanie gets into some of the weeds on some data that I don't do on here because I'm trying to keep it shorter on here. So continue to listen to both, but understand that like if you hear this show, it's basically the same numbers that you'll see tomorrow. Unless I'm hoping that sometime tonight they'll fix whatever the problem is on that vaccine page, so that tomorrow morning we'll have more vaccine data for you. I don't know. We'll have to see. So thank you, Laura, for the question. One other, speaking of morning stories, one other story I will mention is, Leilata G is the feature story this morning. She is a nonprofit executive. She's been a domestic violence advocate for Black women and girls for many, many years, and is now sort of come out as an artist in the past like 3 years or so. And this Friday, she's having her first gallery night. Madison Museum of Contemporary Art has its gallery night this Friday. 60 galleries across the city, and galleries is pretty loose. They're in coffee shops, they're in storefronts, they're anywhere you can hang art. They do a gallery night. It's a really exciting thing. Citywide art night, basically. And Leilata G's having her first one. And hers is in Monroe Street, 1619 Monroe Street, in Madison City Dream Homes. And she's got a lot of art. Her art is very accessible and affordable, and you can buy some of that. And that funds her other nonprofit, which is called Defending Black Girls. So take a look at that story. It's on Madison365.org. It's really cool. It's some pictures of the art stuff. So have a look at that. That is all I have for you tonight. Have a wonderful evening. We'll be back tomorrow, as Laura knows, with the podcast in the morning. I have kind of a big story in the morning. So we'll be talking about the podcast. On the podcast, we will have a big story that's going to make it go. That'll be on the website again tomorrow morning as well. But until then, so get the podcast tomorrow morning. It's not a great story. It's an important story, but it's like one of those that you go like, nothing violent, nobody sad like that, but just trust me. Come to the website tomorrow morning, Madison365.org. Get the podcast. We'll talk through that story. But until then, have a wonderful evening, and we'll talk to you soon.
This is 365 Media.